of students with a chronic condition is increasing. The occurrence of asthma increased from 6.8 million cases in 1980 to 17.3 million cases in 1999. They estimate that more than 25 million people will have asthma in the United States. The most common health emergency that you might encounter at the school are allergies, asthma, diabetes, and seizures. School employees' role. As emergencies become more common, it is necessary that we need to know how to help a student or a fellow coworker during an event. Since these events could be the difference between life and death, it is important to know how to recognize symptoms and know how to help someone suffering an emergency. Introduction to asthma. All staff should be familiar with a health condition known as asthma. Understanding asthma and knowing its symptoms are key to helping those who suffer with this ailment. What is asthma? Asthma is a controllable but not curable obstructive lung disease caused by an excessive reaction of the airways to certain triggers. It can be life-threatening if it's not managed properly. Asthma conditions can worsen to a stage commonly known as an asthma attack, which is an extremely serious health condition. Components of an asthma attack: bronchospasm, inflammation, increased mucus production. Signs and symptoms of an asthma attack include wheezing and coughing, shortness of breath, difficulty speaking, tight feeling in the chest, dry mouth, fatigue, itchy skin. Myths about asthma. It's also important to dispel some myths. For example, asthma is not contagious and it is not infectious. How can you help? Recognizing the signs and symptoms. Don't panic. Reassure and calm the student. Look at the student's healthcare plan. Call or have someone call for help. Ask the student if she or he has an inhaler. Suggest deep coughing to bring up mucus or belly breathing to relax the student. Treatments for asthma include two major classifications: long-term control or quick relief. Long-term control medications are taken regularly for long-acting control of asthma symptoms. For example, Medrol, cromolyn, and prednisone. Quick relief medications are dispensed by nebulizer or inhaler for quick relief asthma symptoms, which includes albuterol, Ventolin, Max Air or Proventil, and one other is Xopenex. There are many sizes and shapes for inhalers as well as colors. Inhalers without chambers are administered 1 to 2 inches from the mouth. Each spray of medication is a puff. When to consider calling for help. When wheezing or coughing is increasing after taking medication, breathing difficulties persist with either the student showing visible retractions or being in a hunched over position, the student has trouble walking or talking or stops playing and cannot start again, fingernails or lips are turning blue, We don't have the peak flow in the clinics, but you are able to check a pulse oximeter. Triggers include weather, pollutions, smoke, colds or illnesses, pets, indoor pollution, pollens, and exercise. There are life-threatening allergies. According to the CDC, an estimated 50 million Americans suffer from all types of allergies, including indoor, outdoor, food and drug, latex, insect, skin, and eye allergies. Allergy prevalence overall has been increasing since the early 1980s across all age, gender, and racial groups. Allergy is the fifth leading chronic disease in the U.S. among all ages, and the third most common chronic disease among children under 18. Allergic reactions. So what are types of life-threatening allergies more prevalent among students? School staff members should be especially aware of the following allergies: bees, wasps, hornets, and fire ants, latex or rubber. It is important to know some students with special needs, such as those with spina bifida, often have latex allergies. Items that may contain latex or rubber in the classroom include gloves, toys, pencil erasers, balloons, adhesive tape, bandages. Be sure to use non-latex gloves and avoid these items in the classroom. Nut and peanut allergies. Students can be allergic to only tree nuts, such as almonds or walnuts, and are able to eat peanuts. Conversely, some students may be allergic to only peanuts and are able to eat tree nuts. However, some students may be allergic to both peanuts and tree nuts. Here's a little bit of information on the difference between nuts versus peanuts. Foods and products containing nuts. Be sure to check labels. Make sure that the appropriate documentation is completed by parents and providers and provided to the clinic. If a student needs an EpiPen and has a food allergy, that also has to be corresponded with the nutritional services for the campus. You are able to send out reminders around the holidays to teachers and administrators regarding potential risks with fundraisers, parties, and treats being brought in from outside the school. Anaphylaxis. Anaphylaxis is when the allergic reaction is life-threatening. Students with anaphylaxis should have an individualized healthcare plan prepared by their doctor. Teachers of students with anaphylaxis should be familiar with the healthcare plan and the emergency actions that may be necessary. And they will be made familiar by the nurse for that campus who creates additional documentation based on the doctor's IHP to provide to the teachers and administrators. Signs and symptoms of an anaphylactic episode. Obviously, throat closing off, sweating, weakness, feelings of apprehension or fear, tingling in the mouth, face, or throat, turning red, itching, wheezing, changes in breathing, loss of consciousness, and swelling of the extremities and/or face. Shock is the most severe type of anaphylaxis, which can lead to death within minutes if left untreated. Some students with anaphylaxis will carry an EpiPen with them at all times. If they are a self-carry student for an emergency medication, make sure appropriate documentation is completed for this. Each brand of EpiPen has its own labels and instructions for use. Please familiarize yourself with them if it differs from any brand you are used to seeing. You can easily Google that brand, and there are instructions manuals online. You do not have to open that student's EpiPen package. After using an EpiPen, massage the injection area for 10 seconds. Call 911 immediately, or that should have been delegated already. Put the EpiPen back into its container and send with the student when EMS arrives. Note and document the time you use the EpiPen, and be prepared to initiate CPR if the student stops breathing. Introduction to diabetes. Diabetes is one of the most common chronic health conditions faced by schools. Both the short-term and long-term consequences of the disease are serious. Diabetes is actually the 6th leading cause of death by disease in North America. Each year, approximately 13,000 students are diagnosed with type 1 diabetes. In addition, healthcare providers are finding more and more children diagnosed with type 2 diabetes, even though, until recently, this type of diabetes was only diagnosed in adults. Diabetes is a serious chronic disease that impairs the body's ability to use food for energy. It stems from a disorder of the pancreas, the organ that manufactures insulin. Insulin is